Hi, welcome to my presentation. I am a graduate student at the University of Central Missouri. My name is Mary, and today I'm going to discuss a topic that affects millions of families across the United States, but still does not quite get the attention that it deserves, and that is treatment coverage for infertility. I'm also going to discuss why the right healthcare policy could change everything for women and families suffering with infertility. So here we go. Infertility isn't just a medical diagnosis, it's a major public health concern. 1 in 5 married women struggle with infertility, and treatment is often unaffordable or completely out of reach for many. This is because insurance coverage for infertility care is inconsistent, patchy, and deeply inequitable. Some states offer great coverage, while others offer none at all. Missouri is one of those states. And with this being the case, this forces women to absorb the full financial and emotional burden of the care that comes with infertility. This lack of coverage doesn't just create inconvenience, it creates health disparities, mental health strain, financial hardship, and in many cases, the heartbreaking loss of the dream to become a parent because they cannot afford treatment. Infertility became a policy issue because state laws vary dramatically. Right now, only 21 states require insurers to offer or cover infertility services. And even among those, what's covered does differ wildly. For example, states like Massachusetts and Illinois provide comprehensive coverage, including IVF. But on the other hand, many states offer no coverage at all, leaving women to pay out of pocket for treatment that can cost anywhere between $12,000 to $20,000 per IVF cycle, and a lot of women require more than one cycle. So at a federal level, things aren't much better there either. The Affordable Care Act, which is a landmark in expanding healthcare, covers maternity and newborn care, but does not include infertility treatment as an essential health benefit. And so that means your access to reproductive care largely depends on your zip code and not your medical needs, and that is a huge problem. So, if we're going to talk kind of about the human side, infertility carries stigma, emotional trauma, and heavy mental health costs. Women report shame, isolation, anxiety, and depression, all which worsen when treatment is financially out of reach for them. And then disparities are even more alarming. Black and Hispanic women experience infertility at higher rates, but they are less likely to seek or receive care, not because they don't want children, but because of cultural stigma, lack of provider diversity, and financial barriers. And then on top of the emotional toll that comes with infertility, the economic burden is overwhelming. Many families drain savings or take on a huge load of debt, and some even abandon the treatment altogether because the financial strain is just too much. In the workforce, infertility-related issue stress leads to decreased productivity, missed work days, and mental health challenges. So from any angle that you look at infertility treatment costs, medical, emotional, or financial, infertility care is glaring inequity in our healthcare system. So what can we do? The good news is that policymakers have proposed several solutions. One of them is the Federal Infertility Insurance Coverage Act, which would require insurance plans nationwide to cover infertility treatment, including IVF. It would standardize coverage, close state-by-state disparities, and increase early access to care. There's also the infertility tax credit and grant programs. This would help uninsured or underinsured individuals pay for treatment through refundable tax credits and federal grants. And then one other option is the Medicaid infertility care expansion. This would include IVF and infertility treatment under Medicaid, helping low-income women who currently have no access to treatment at all. But when you compare the three of these, one policy I think is the most viable would be the Federal Infertility Insurance Coverage Act. And that is because it eliminates geographic disparities and ensures nationwide access and supports both low and middle income class families. It also aligns with current public health needs, strong advocacy from organizations like the American College of Gynecology and Resolve, which is the National Infertility Advocacy Group, and growing bipartisan support for reproductive justice. This policy would finally make infertility care accessible, affordable, and fair, giving every woman, not just those with financial privileges, the chance to pursue motherhood. Some key stakeholders in this would be our state legislators, which for District 7 would be Patty Lewis, Eric Burleson, Eric Schmidt, and Josh Hawley. We also could involve advocacy groups like Resolve and professional organizations such as the American College of Gynecology and then the Missouri Department of Health and Senior Services and insurance companies. And then most importantly, parents and families who could share their stories to help get this coverage. As a nurse and provider, we play a powerful role here as well. We would be the ones doing the educating, the advocating, and helping patients navigate an unfair system, making them essential partners in driving reform. So wrapping up, infertility isn't just a private struggle. It is a public health issue that demands national attention and policy reform. By expanding coverage and ensuring equitable access to infertility care, we can improve mental health, we can strengthen families, and advance reproductive justice for millions of women across the country. Thank you for listening, and have a good night.